Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report. The total number of cases remains at 290. One individual is hospitalized and there's no one in ICU. Yesterday, 582 lab tests were performed, taking our total to 36,402 tests. Earlier today, we announced a number of changes that may be introduced as a draft plan for Phase 2 as we continue to try to restore services in Manitoba. We've looked at a number of key factors when making these recommendations, including how the virus is spread and how it's been controlled. We have the stability of the healthcare system's capacity, as well as public health system capacity, and we've limited number of outbreaks in vulnerable settings. Based on this and our current case numbers and testing data and other public health information, we've been comfortable with making these recommendations to consider additional loosening of the restrictions. We continue to review our data quite closely as we loosen restrictions, and we'll make changes accordingly. And we continue to remind Manitobans that as we make these recommendations and these loosening of restrictions, it's not a return to normal, that we're still dealing with this virus. This virus is still in Manitoba. And if we don't take the cautions that we've already been taking, we could see increasing numbers going forward. We're going to need to deal with this virus for the foreseeable future in Manitoba. This virus has not gone away, and it's not going to go away. So we need to live in this new normal, to continue to loosen restrictions, to continue to find ways to keep our economy moving, to get back to a new normal. But at the same time, we need to ensure we're taking these precautions, washing our hands frequently, disinfecting frequently used surfaces, maintaining that physical distancing whenever possible, and most important of all is to stay home when you're ill. We can't have in this context people going through work, battling through a cold, out in public with cold symptoms. So anyone with respiratory illness, fever, cough, shortness of breath, sore throat, we really need you to stay home, get tested. But we just can't have people at work or in workplaces who are showing signs of illness. And again, it's not the blame. This is something that we've probably all done in the past. Battle through that cold just to get things done. This is not part of our new normal. Our new normal is people who are showing signs of illness cannot be out in public. We're continuing to remind Manitobans that any symptomatic Manitoban is eligible for testing, and you're eligible to go directly to one of our testing sites, so we can continue to encourage that. If you have any symptoms, sore throat, fever, cough, runny nose, do present for testing. It's important as we move forward to find cases early, have them isolated, do thorough contact investigation, and isolate those contacts. Those in high-risk categories, those over age 65, those with underlying medical conditions, those with immune compromise, need to take extra precautions. We need to protect those individuals who are at significant risk of severe outcome should they acquire COVID-19. So those individuals need to continue to limit their exposure to others, to ensure they're washing their hands, to ensure they do what they can to limit their close contact with others. Businesses that have questions about how the orders apply can contact engagemb.ca. Manitobans can continue to access credible information at manitoba.ca/COVID-19 for up-to-date information on the virus. And again, once again, thanks to all Manitobans for your efforts, and I'll pass over to Lanette.
Thank you. I'm Lanette Siragusa, Chief Nursing Officer for Shared Health. Good afternoon. I'd like to begin today by giving a quick thanks to the Brandon Area Car Enthusiasts and Road Rebels group. These two car groups have been organizing vehicle parades that drive by the Brandon Regional Health Center, personal care homes, and independent living facilities. In the past 2 months, we have seen a number of parades across the province that involved emergency vehicles, Canada Post vans, and tow trucks. These specific parades involving 100 classic cars is quite a sight, and they have been greatly appreciated by our staff and our residents. So your support provides yet another reminder to staff and residents that we are all in this together. Thank you. I would also like to speak to you today about reinstating services specifically related to surgery and diagnostics procedures. So as you are aware, in March, as part of the planning and preparation to ensure that our healthcare system had the capacity to care for COVID patients, we did begin pulling back on elective and non-urgent surgery procedures, diagnostics, and lab activities. And these were necessary precautions for both staff and patients in light of the risk that this virus posed. However, they have resulted in canceled, postponed, and unscheduled appointments for Manitobans. We know that COVID is going to be with us for longer term, and postponing care for our patients is not something that we can continue indefinitely. So clinical leads from across the province are now working on plans to safely and gradually ramp up services in surgery, diagnostics, and elsewhere. We have said before that this is not a return to normal and that there will likely be times where we have to ramp down activity in order to increase our capacity to care for COVID patients. So our planning does account for this. And we are cautiously ramping up now the clinical and diagnostic activity across the province, scheduling patients according to priority of care that they need. So an update for you is that during the first week of our pandemic response, surgical cases did drop dramatically to about 1/3 of what our normal activity would be. And last week, that activity has increased to about 2/3 of the pre-pandemic volumes. As well, in diagnostic imaging, cases had dropped below half, around 45% of their normal baseline in the early weeks, and had increased to approximately 76% of the pre-pandemic activity. Lab test volumes last week were at about 75% of the pre-pandemic volumes, after dipping to around 50% in early April. The decisions on resumption of clinical activities are being coordinated provincially and are informed by our clinical leaders to ensure that the plans are in place to appropriately prioritize patient services and also to protect staff. Patients are being contacted directly for appointments and will be provided specific directions on steps they need to take when receiving care at this time. The physical distancing, the hand washing, and appropriate use of personal protective equipment all remain important tools in our effort to provide safe care and prevent the spread of COVID-19. And the plans must include also those contingencies to, if we have to rapidly postpone or cancel services, we are looking at what that would look like as well. So closely monitoring volumes, staffing levels, available equipment, and beds across the province is ongoing and will help us identify when the time is to change our course. We have learned a lot through the first ramp down of clinical activity, and while planning and preparations are ongoing, we're confident in our ability to resume some services now while ensuring we can quickly create significant capacity within the future if we need it. Finally, I just want to provide a quick note on the community testing site in Ericsdale. It has closed down temporarily, but is expected to reopen Friday, tomorrow, after a fire had occurred down the street from there. So we're hoping everybody is safe and okay in Ericsdale. And we can open the line to questions.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this afternoon, from the Brandon Sun, Drew.
Thank you. This is Drew May from the Brandon Sun. In the early stages of the pandemic, the province did disclose to the public when healthcare workers and nurses tested positive for COVID-19, like at the personal care home in Gimli and the Riverview Health Center. But on May 10th, when an employee of daughter on call here in Brandon tested positive, and they deal with seniors, the province didn't notify the public. Why is that?
Well, for our typical approach at all times was to notify the public if it had an impact on the general public's health. And so for that case, we were able to contact trace and notify all contacts. That wasn't a facility, a licensed facility that took place on, that where we typically would report outbreaks or cases in a registered facility. But yeah, so I mean, for the most part, with most of our cases, we do very quick contact tracing. If we look at our numbers that we can evaluate, over 90% of contacts have been addressed within 24 hours of notification of this, and so that's the real important issue there, not necessarily disclosing to the public when we feel that the public hasn't been put at risk.
Okay, thank you for that. And also, we're hearing from some business owners here in Brandon that the province has specifically told them not to tell the public when an employee does test positive for COVID-19. Is that the case?
Well, the public health wouldn't communicate anything of the sort on what people can do. It's personal health information, so we wouldn't notify the employer unless it was absolutely necessary to do so. And then it would still be personal health information, so I don't think that it should be disclosed beyond that. Public health will disclose to the public, and we have done so when we feel it's important for the public to know. If we thought that there were people who may have been contacted that we couldn't identify. So other than that, there's things like stigma and fear that really help this virus spread. And so we need to control that. So if public health feels that there's a need to disclose information like that to the public, we absolutely will. But when it's not necessary, then it only can cause further harms.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB here. Dr. Roussin, as far as the phase 2 of reopening goes, the list of things slated to reopen in phase 2 initially was a lot more limited. Today's announcement is pretty significant, especially including a lot of things that were originally included in future waves. I certainly recognize the caseload we have now versus what we may have expected can impact this, but can you explain why some of the services or businesses that were moved up into phase 2 were moved up as they were, and thinking of things like swimming pools, bars, gyms, tattoo parlors? What are some of the factors that allow these to be included in the draw for phase 2? Is it a case of the risk maybe being seen as lower for these things than initially thought, or was it a case of coming up with creative measures?
Yeah, I think it's more that we wanted to be able to have a real broad continuation of our reopen strategy to get as many things safely moving as possible. And we felt that we would be able to get as many things open with very significant restrictions. We thought that was the best approach here. So if you can review some of the guidelines that are on there, it's still very strict restrictions. We feel that if those are followed, which we see Manitobans have been following our advice, that we're going to continue to be able to reopen things, but really control the transmission of that virus within those places. And so that was the thought there, to be a bit more broad, but restrictive within those openings.
Okay, thank you. And then just as a follow-up, obviously no date is sort of set for phase 2 at this point, outside the pro sports teams being allowed to access facilities, and of course the gathering size is increasing. But what kind of notice will you be giving so that businesses can kind of prepare and get ready to open with these new distancing measures and requirements in place? Obviously, this list is out today. I know when the first phase happened, it was kind of really just over the weekend that businesses were given a chance to prepare. Will that be a case of we'll get a date pretty darn soon and things will be reopening as early as next week?
Yeah, we're hoping to be able to give better notice than the last time. With phase one, again, we loosened restrictions as soon as we felt that it was appropriate. So we didn't really have the opportunity to give much notice because until we knew it was safe, we couldn't notify anyone. Now we have a plan, that sort of June 1 target date that we've been looking at. And so we're hoping to be able to give a bit more notice than last time. But again, we're still relatively early after that first incubation period of phase one. So we want a few more days to be able to see trends, see what's occurring in these days. But we're hopeful that we'll be able to give some more notice.
From the Winnipeg Sun, Scott.
Hi, Dr. Roussin. Scott Billick from the Winnipeg Sun. Just a question. Could you maybe outline just exactly what you are looking for within the numbers, within the epidemiology, all that kind of stuff as to when, or what trends are you looking to stay low? Like obviously the positive test ratios remain low and all that stuff. So what is there any tangible numbers that you're waiting for the province to hit in terms of COVID-19?
Well, certainly, right now, we're in all of the in the significant indicators that we're looking at. We're in that green zone right now. We're in the zone we want to be in to keep moving forward. It's just that we're relatively early after the first incubation period of phase one, so we want to make sure that it stays in that area. But the viral transmission dynamic indicators that we're looking at is the percent positive tests. And that's really low. If we're looking at the last 5 days, it's actually at 0 right now, and we want to keep that number low. The number of what we'd call epi-link cases, or what we have been referring to as community cases, we want to keep those numbers low. And the last 7 days, those have actually been 0 right now. And so we're looking at other indicators like hospital bed utilization, ICU bed utilization. So it's not just one or two indicators that we look at. So we don't have just a specific number that we hit that would make us want to pull back. It's trends and it's a number of indicators.
Okay, thank you. And my follow-up would be, and I've asked you about self-isolation for sports. So with this whole thing, with practice facilities opening, and there's rules, different leagues not even allowing it to happen anyway, just for unfair reasons, uncompetitive reasons. But for players that are, say, in Canada that want to come back and train in the facilities, are exemptions, and you said they're in the works, but are those in place at this point for at least Canadian players to return to the province without having to self-isolate or less self-isolation? And can you speak to all, even internationally, what those players can do? Because a majority of players for the Bombers, the Jets are not in town right now.
Right. Yeah. So as of right now, no, those travel. The mandatory 14-day self-isolation, it would still apply if it's interprovincial travel without any other exemptions. The international travel restrictions are in place, but they do allow crossing for work purposes. But the self-isolation will still be required at this point. So able to use the facilities right now, but the other public health measures will still be in place for the foreseeable future.
From CBC Radio Canada, Laisa.
Oh, yeah. Hi, my question will be for Dr. Roussin. And my question is to know, now we're talking about reopening, we're talking about the phase two. What are the restrictions regarding fishing lodge so far?
Sorry, I didn't catch the last the restrictions regarding
Fishing lodge.
fishing lodges. So Yeah, so they would be, needing to maintain those the physical distancing and all the typical measures like that. We are looking at ways of allowing travel directly to those type of establishments, directly to and from, so to ensure that we still have the restriction on travel to communities, especially remote isolated communities. But those the restrictions on those lodges will remain, but we're going to try to see if there's a way to safely allow people to travel directly to and from those type of establishments.
And the other question would be, since we're talking about reopening, one of the points that's been argument that's been given is that the number of cases that we have in Manitoba has been keeping going down. And now that we are reopening, if we have more cases, you said like the government is ready to stay back and maybe taking other restrictions. How many cases, let's say in the worst case, after how many cases the province can consider that maybe it's necessary to close again?
Yeah, and so as we gradually lift these things, right, certainly not a return to normal. A lot of restrictions still in place, although we're allowing a lot of things to commence again with a lot of restrictions. We're following a number of indicators, and so I was mentioning the positive test rate, the number of those non-epi-linked cases. We're measuring visits to ER, hospital capacity, ICU capacity. So it's a number of indicators that we'll be following over time, and looking at those trends, then it's going to make us decide on whether we need to tighten things up more or if we need to prolong a phase. So we'll be watching those quite closely. It's important to note that this virus isn't gone. It's still here. The Manitobans are going to have to deal with this virus in moving forward for the foreseeable future. So we're going to need to learn how to deal with this virus. We can't stay in a lockdown for a year, right? So we need to find a way to reopen things safely and cautiously, but we're certainly not done with this virus.
From CBC Manitoba, Ian.
Good afternoon. Dr. Roussin, we're hearing of 8 new cases, perhaps a cluster. Are you aware of this?
I'm not aware of any clusters going on right now. As far as cases go, cases get reported throughout the day. They'll be sent out to the region for investigation. They also need to be validated at public health because certain people have been tested more than once and things. So I don't have any cases to report, but just like any day, we receive lab results throughout the day.
Was there ever a date attached to phase 2 of the reopening?
There's never solid dates for it, like for as far as the loosening of group sizes. We said that mid-May we would take a serious look at that. And then we had that no phase 2 would be considered prior to June 1. And so right now we seem to be on track with it, but we don't have a solid date in place as of yet.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, you talked earlier about wanting to give everybody more advance notice this time, and we're about 10 days away from June 1st. So are you looking at phase 2 starting sometime after June 1st?
Not necessarily right now. We don't have a solid date. I think that our goal is certainly to have it start on time, or even a couple of days earlier. It's a balance. If we announce a hard date, then then there's implications. Businesses start getting ready for that date, and we are just days after the first incubation period of the phase 1. And so we just don't want to be in a position to announce a solid date right this second, and then early next week have to say, we better take a few more days to look at it over. So it's that balance. It's a balance of giving appropriate notice, but being able to provide a solid date that people can rely on.
Okay, and I have a question about the specific measure for religious or other organizations to hold outdoor services. The bulletin today says there won't be a limitation on numbers that people stay in their vehicles outdoors. Are religious services in phase 2, will they be allowed to resume subject to the 25 and 50 person limits outlined?
That's right. Yeah. So those personal, the gathering limits, the public gathering limits have always applied to the faith-based organizations, and they'll continue to apply. So 25 indoor, 50 outdoor will begin on Friday, and so that's definitely an option.
From CTV Winnipeg, John.
Hello, it's John Hendricks from CTV Winnipeg. This question is for Dr. Roussin. I see that schools will be capped at 50% of capacity. I'm wondering, will this be the case for the next school year? And if so, will this mean that remote learning will be required? And I'm wondering what implications that might have for childcare.
Yeah, so the details of the new year are not set out yet. So what I can say is that it's certainly not going to look like it's looked in the past, right? This is a new normal, and so there's going to be ways that we need to figure out to ensure physical distancing, and so there are multiple ways of doing that, and I imagine not every school is going to look the same in that regard. But it's certainly not going to be the same way as it is in the past. We need to find ways of getting things moving forward while dealing with this virus. And again, probably the most important thing is that this fall we're not going to have sick kids or sick employees coming to work. It just can't happen anymore. And there's going to have to be real strict policies in that regard. But I don't have, we don't have the exact details of how that's going to look right now.
Thank you. I also wanted to ask you, I see that travel to the north of the 53rd parallel, will be allowed. I'm wondering what sort of consultation was done with First Nations, and do they support the lifting of these restrictions?
Yeah, so it's still early, right? We don't have a set date on this, and this is the announcement of the draft plan is sort of this consultation period now. So we do plan on looking at that further. With this, we took that into account for sure. This is again that balance on having things moving with with the economy, with businesses that rely on these things and on a relatively short season, and protecting susceptible communities for large outbreaks. So any of these loosening of the restrictions would be very specific. They're going to be directly to and directly from. People aren't going to be visiting communities, and certainly people need to respect First Nation communities on their policies on whether they can enter or not. So it's going to be a balance, but we're going to continue to consult in that regard.
From City News, Stephanie.
Dr. Roussin, Stephanie Lesuk from City News. With all the talk about really making sure that employees stay home when they're sick and don't go to work, is there going to be significant changes to businesses' sick leave policies?
Well, I mean, this is a great question. This is the kind of thing that we were talking about even before we had a case here, really early on, is that we're all in this together, and employers who don't make it, don't give employees a reasonable opportunity to stay home when sick, the alternative is they're going to come to work when sick, and that has huge implications. So I would encourage all employers to think about things like this. How can you support employees that need to stay home when they're sick? How can you support employees that need to stay home when they're self-isolating? Because the alternative is that they will come to work when they're supposed to be self-isolating or when they're ill. And that's going to have a major impact on a work environment. So we're all in this together, and this is that new normal. And so, everyone needs to think about what role they can play to limit the spread of this virus.
Okay, just a quick follow-up. Are there any businesses that are not allowed to reopen under the Phase 2 draft?
Well, it's a large gathering area, so the indoor indoor cinemas, casinos, of the such, the indoor amusement type things, and large fairs or amusement parks aren't going to open this phase. So we do have a fairly broad reopening, but again, a broad reopening with many restrictions to ensure people are following guidelines to reduce the risk of spreading the virus.
From the Winnipeg Free Press, Carol.
Hi, it's Carol Sanders with the Free Press. Dr. Roussin, you said earlier that there would be appropriate notice for Phase 2. What do you consider to be appropriate notice? Would that be a week, a weekend? I don't know. What does appropriate notice look like?
Yeah, and like I said, it's a balance, right? So I mean, we want to be able to leave the restrictions on for as short as period of time, right? So as long as as soon as we know it's going to be a safe time to lift those restrictions, then we want to. We want to balance that with being able to give notice. But even today, to give a solid, definite date, we could be faced in a position next week that we have to change that date. And that could have serious implications on people who have put in a lot of plans to open on a certain date. So it's balance. It's a difficult time, right? We haven't dealt with this type of issue before, so it's a balance of these very strict public health restrictions we've placed on people that have significant effect. But we've managed to flatten that curve. But we need to ensure we do it safely and cautiously. But we have to, we want to take in consideration and give some of that notice. So what does that look like? I'm hoping it's multiple days at least that we could give people for that. But like I said, it's a balance. We don't want to extend the restrictions longer than we have to. But we want to be in a position where we can give a definite date that people can rely on.
Okay, we've had really low numbers so far. What would it take to change the date? Would it be like a super spreader incident? Could it take one person at an outdoor gathering infecting 50 people who infect 50 people? What would it take? Like I'm thinking, between now and June 1st for plans to change or for dates to be pushed back?
Yeah, I mean, it would have to be. We're certainly not going to rely on on one day or one group of cases. We have multiple indicators that we look at, but we'd be looking at a trend. So certainly, if we were looking at an upward trend for some reason moving forward, then it might make us a bit more cautious about things. And so it's multiple indicators we look at over a period of time. So it's not just one thing that would make us change our mind.
From Global, Brittany.
Good afternoon, Dr. Roussin. I'm wondering if we might follow what we're seeing some states doing when it comes to contact tracing as we begin to reopen more places. Places like Washington right now are saying as restaurants reopen, they'd be requiring people to leave contact information so that they can easily do more contact tracing. Is that something that we might consider here in Manitoba?
We weren't looking at that right now. I think that we're taking the approach that if you have a restaurant operating that is adhering to the physical distancing and has everything in place, then we shouldn't have a large contact chain to look at. And so certainly we've been quite good at gathering a lot of information from people. And I think if we were in a spot where we felt, like our most recent case, we felt like there's members of the public that have been exposed that we may not be able to identify and then certainly would not be able to contact, then we would make an announcement, again, with the timing and things. So we haven't put those measures in place as of yet, but we have robust contact tracing abilities here.
Thank you. And I know you said it doesn't come down to just one number when there's a tipping point here, but it has been a number of weeks before we've really seen double-digit numbers in one day of COVID cases. Is that going to be a significant indicator, or are we looking more at hospital visits and ICU in terms of that tipping point?
Yeah, it's all of them. None of them would be one thing. So I think that the trend of the positive test rate is a real important trend to look at, because we won't get to have the artifact of increased amount of testing that could guide us or mislead us. And certainly if we find large number of cases within a small cluster, then again, that's not like it's a number of community-based transmissions that have taken place. So it's a number of factors that we'll be looking at over time. We can't look at just one thing.
Thank you. We have a few minutes left today, so if there are any unasked questions from media, please do so now.
Yeah, Dr. Roussin, it's Brittany from Global again. I'm wondering if you guys have made any decisions when it comes to the antibody testing and what that's going to look like here in Manitoba when it does come.
So Manitoba is participating in a national task group on that right now, and they're working out what's the best way to undertake seroprevalence studies. So when you look at things like that, it's like what populations are we going to want to know about to give us a good guide on what's the actual proportion of Canadians and Manitobans that have been affected by the virus. So that work is being worked on right now, and we don't have any specific decisions on that as of yet. I do note that it's early on. We're just validating those tests right now, and we don't know what a antibody means right now. We don't know if it confers immunity. We don't know if it does confirm immunity. Does it how long that lasts or how potent it is? So we're still early in that, but we are working at the national level to come up with a good approach.
Ian Fraser, Dr. Roussin, are you aware of 8 new cases today?
We don't have the cases to report. So what happens is that if there's any positive lab results that come back, they need to be confirmed at the surveillance department. They need to be sent out to the region, and the region needs to assess that the individual. So I can't discuss any cases that haven't been confirmed to me.
Dr. Roussin, I'm curious why church groups are not being allowed to hold indoor services at 50% capacity.
Yeah, and so what this is looking at the epidemiology of this pandemic, and we've seen multiple super spreader events in those venues, and so it's a concerning venue, prolonged, close indoor contact, singing. All these factors play a role. So it's not like we're definitely far from that. I think we're going to be engaging groups, and I think we can move forward on trying to accommodate those type of things a bit better. But that's the reason why we haven't just landed on that right at this point.
Dr. Roussin, do you have an update on the investigations into the home care worker in Brandon and also into the case at the Walmart?
Yeah, so there hasn't been anything further of that. I'm not aware of any further secondary cases to the Brandon case, and I'm not aware of any secondary cases of the Walmart case either.
Any requirements for isolation in either of those 2 cases?
Yeah, I'm sure there were. I don't have the exact numbers on that. There'll be close contacts of both cases that would be advised to self-isolate.
Do you have any concerns for gyms and patrons at these gyms? Because there's going to be a lot of sweating and so forth that might happen in facilities like this.
Yeah, and so I mean we're concerned about all the locations. That's why we put a number of restrictions in place there, and so it's going to be really important that moving forward, that Manitobans pay very strict caution to these restrictions, detailed and thorough disinfection of frequently used surfaces. We have restrictions on using the locker rooms, physical distancing. All these are important, right? And our numbers have been favorable, but they don't have to remain that way, right? This virus is still here in Manitoba, and if we loosen up and we stop following the things that got us here, we could see a surge in these numbers. So we have to be careful in all of these venues.
Dr. This is Drew Matheson. Just to follow up on my previous question, but have businesses specifically been told by the province not to inform the public when one of their employees gets sick?
They wouldn't have been told that from the province. I think that it's confidential information. It's not useful information unless public health feels that there is a risk to the public being exposed in that site. And so. Yeah, I'm not sure where it came from. I'm not aware of why the province would tell somebody that. I think that it's we could probably give my advice would be not to disclose it unless public health thought it was relevant.
Dr. Roussin, you've long called for sort of 2 incubation periods to ensure that we're ready for phase 2. What's giving you the confidence now to perhaps speed up that process?
Yeah, and so I mean, I think certainly the group sizes right now, we looked at some favorable numbers for a number of weeks, and we did say that we would look at those group sizes prior to the end of the second incubation period. We said even mid-May that we would look at it, and so I think that those numbers have been favorable, and I think that Manitobans have been really stepping up to get us here. And I think Manitobans are ready to continue their work, but we can loosen some of these restrictions. And then at the end of next week, we're into that getting into that second end of the second incubation. So we're not going to be too far advanced of the 2 incubation periods.
Dr. Roussin, once we've opened in phase 2, how many weeks or is it another 2 incubation periods that you'd be looking at before even considering reopening for phase 3 and anything further?
Yeah, it would be much the same thing, 3 to 4 weeks. Those 2 incubation periods, so 3 to 4 weeks or so, and then we could look at a further reopening.
Film crews could be allowed to come, I guess, from other provinces, if I'm understanding correctly. How are we going to balance sort of that public concern with, the desire to get film production going again?
Yeah, and you're right. It's exactly that. It's a balance, right? So all of this is a balance, right? So when we've been dealing with this virus, we needed to balance the risk of the virus compared to the risk of an economic slowdown, right? Both have impacts on health. And so with the film community, we're going to work very closely with guidelines to ensure we're protecting them, and as well, and more importantly, that we're going to protect the health of Manitobans as we see this move forward. And certainly not unique to that the film industry. We're doing this with all industry.
Thank you, and this concludes today's media briefing.
Thanks.